Dear friends, we are in the midst of a pandemic, which in fact most of us might not have seen. Because of the reality of a connected world, where any place from anywhere in the world is just few hours away, we have to accept the fact that anything happening anywhere will have an impact on others. And that is exactly what has happened in the case of the COVID-19. China, it started, and it was such a small thing when we heard it first, but it has spread all across the world to more than 150 countries, and that is now producing havoc everywhere in the health of people, in the economy of the world, and in everything for that matter. What is, after all, COVID-19? It is an influenza virus which affects our respiratory system. It is something which was there earlier. It comes and goes every year. There is an influenza virus which happens, and there are sometimes little more severe ones like the SARS or the MERS, which are of the same virus, coronavirus, which happened earlier. But this virus is slightly different because it spreads much more faster. It is not dangerous in the sense that it doesn't produce that much of death or mortality when compared to other serious illnesses that we heard in the recent past, like the Ebola or the Nipah. The mortality rate is very, very low. It is considered to be around 3% of people. That also the older people and the people who are having debilitating illnesses and all, they are the people who die, and most others recover. Social distancing, that's going as much as possible without interaction with other people. Being a social animal or a social being, human beings can't do that, but this is a special situation where you have to see that you avoid contacts as much as possible. Unless it is absolutely necessary, avoid crowding as well as getting together. Now, you have to also be careful while you are traveling. In case you are forced to travel or you are coming back into a country, you have to go into a quarantine yourself, a forced quarantine, which will avoid, if you are, God forbid, infected, this going into other people. At the same time, we should understand that we should respect the dignity of people, and we should not be thinking that this is such a bad thing that somebody may have this. It is not due to any fault of his that he is getting that, and we have to give that human decency and consider people who are affected with that respect. That is unfortunately not happening. Washing hands properly, maybe for 30 seconds, half a minute, with soap and water, is the best way in which you can make sure that this virus doesn't spread. Luckiest thing is that it doesn't spread through air. Most of the spread happens directly. If there is somebody infected, and if the saliva or secretions from that person comes directly onto you, then only it spreads. It doesn't spread through air. And it also spreads through fomites. That is, if you touch something and if you have the virus on your hand, that can be contracted to another person up to 24 or 36 hours. So one thing which I want to highlight is this has got an iceberg phenomenon. The iceberg phenomenon is that only a very small percentage of the cases come out, and it takes some time for that to build up and go into an exponential increase, like what happened in China or in Italy or is happening in other places, Spain and all now. So you won't be knowing that there are cases amongst you. There will be number of cases which are there. It takes 14 days or up to even 22 days as per the latest reports for somebody who is infected to show the symptoms. So in that period, you have to be extremely careful that if you have had an exposure to somebody, and if you know that there is a suspected case, you have to avoid and you have to quarantine yourself. Or if you know that somebody is infected, that person should be encouraged to quarantine. And you have to report to the authorities to get tested and see whether there is an infection. Such people definitely have to be isolated so that they don't spread the disease to others. It is only a matter of time. Within a few weeks, we are going to be out of it. That's what happened in China. But we have to keep that number of cases who are infected at the lowest. And we can come out of that without much of mortality and morbidity. And this is something which is getting under control. There is no requirement for panic, and personal hygiene, social distancing and quarantining is the way in which we must be moving forward to control this COVID-19. And one thing which I want to tell is that this is not going to be the last. There will be other epidemics happening, pandemics happening, because we are in a connected world. And this will be a good lesson for us to learn what is to be done in such situations, because this is something which has come after many years and we don't know actually what to do. But take this as a learning lesson, because all of us are going to be all right as we go forward. There's nothing to worry, and please take this as a learning experience and teach your children about personal hygiene and the care that has to be taken. And I'm sure that all of you are going to be extremely resilient to this attack of COVID, which we will get over within a short period. Thank you.